When Princess Catherine disappeared from the public eye in January 2024 after undergoing unspecified abdominal surgery, rumors ran rampant. By the time March rolled around, the narrative had gotten completely out of control, and even celebrities started to weigh in on the conspiracy theories surrounding the princess' whereabouts. It was internet chaos at its best, and the palace didn't handle the whole media tempest very well. Finally, on March 22, Catherine released a video statement announcing that she'd been diagnosed with cancer. Many wanted to put their foot in their mouth when the statement was released. Catherine explained that, when she underwent abdominal surgery, doctors didn't expect to find any cancer. This was only determined after the procedure. My medical team therefore advised that I should undergo a course of preventative chemotherapy, and I'm now in the early stages of that treatment, she explained. Hello and welcome to Royal Scandal. Please do well to like, subscribe, comment and turn on the notification bell so as not to miss out on any news updates. Conspiracy theories turned into well-wishes, but soon, the public and the press had more questions. What is preventative chemotherapy? And what did it tell us about the state of the future Queen's health? The Princess of Wales didn't elaborate on what type of cancer she'd been diagnosed with nor provided any details on how far it had progressed before her diagnosis. Catherine's cancer announcement video subsequently left people with more questions than answers, and we're here to answer some of them, or at least try to. Number 1. Catherine's treatment offers clues as to what type of cancer she might have. Princess Catherine is remaining tight-lipped about her cancer diagnosis, as is her right, but given that she's receiving preventative chemotherapy, it narrows down the types of cancer she might have a teensy bit. A doctor told Today that while it could be any type of cancer, the major abdominal surgery Catherine had prior to the discovery of her cancer hints that it might be genital, gastrointestinal, or urinary. Aditya Bardia, MD, MPH, told Everyday Health that colon and breast cancer are often treated with preventative chemotherapy after the surgical removal of tumors. Still, despite the fact that we know Catherine had abdominal surgery, we don't know much else, making it hard for doctors to guess what cancer she might have been diagnosed with. Andrea Papiglia, MD, pointed out that abdominal surgery is a pretty common treatment when it comes to removing solid tumors. There are too numerous possible cancers to list them all, Papiglia said. Number 2. Her treatment also indicates that her cancer might have been stage 2 or higher. Princess Catherine's type of cancer might still be a big mystery, but one thing that's a little clearer is how advanced it may be. Speaking to Everyday Health, Andrea Sursic, MD, said that preventative chemotherapy isn't a common treatment for stage 1 cancers, which means that Catherine's cancer had likely progressed past stage 1 by the time doctors discovered it in January 2024. Speaking to Time, Jeremy Jones, MD, explained that preventive chemotherapy can be prescribed under various circumstances, but it's usually only highly recommended for cancers that are in a later stage and have a high chance of coming back in the future. It is prescribed if there is some concern based on the pathology of the tumor or the patient's clinical history to suggest they are at risk of the cancer returning in the future, Catherine Van Loon, MD, told the outlet, adding that doctors might prescribe this treatment when they are being ultra-conservative, which is usually the case with younger patients like Catherine. This means that Catherine might have stage 1 cancer and her doctors are simply overly careful, which we hope is the case, or it might mean that her cancer is pretty aggressive, was in a later stage, and has a high risk of recurring. Number 3. What exactly is preventative chemotherapy? First things first, preventative chemotherapy isn't a technical medical term. As Catherine Van Loon, MD, explained to Time, doctors refer to it as adjuvant chemotherapy. And according to Ben Ho Park, MD, preventative chemotherapy exists to kill remaining cancer cells. Even though the surgeons have removed everything they can see, there could still be cancer cells floating around in the body that, if left untreated, may come back later, and is then incurable, he explained to Today. Teresa Werner, MD, perhaps described the treatment best while making an appearance on the University of Utah's Health Library podcast. The point of chemotherapy is to eradicate any microscopic residual cells to prevent recurrence. So it's not really preventing the cancer because she already had cancer, Werner explained. While the name of the treatment is a little misleading and indicative of chemotherapy used to prevent cancer altogether, Werner made it clear that it's not the case. They're not preventing the cancer in the first place. They're preventing a recurrence, and that's why she's getting chemotherapy, I think, Werner said. Number 4. There's no telling whether Catherine still has cancer, or whether it might return. Given that Princess Catherine is receiving preventative chemotherapy, there are some lingering questions as to whether or not she actually still has cancer. According to doctors, it's impossible to know. Speaking to Today, Ben-Ho Park, MD, explained that patients who receive preventative chemo are sometimes already cured of cancer after surgery, but doctors can't tell for sure, hence the treatment. In other unfortunate instances, undetectable traces of cancer can still be left in the body even after treatment is completed. In truth, we overtreat patients every year because we simply don't know if they still have cancer, Park admitted. A lot of patients get chemotherapy when they're probably already cured. We sincerely hope the latter is true for Catherine. Park added that there's always uncertainty when it comes to cancer and its treatments, and unfortunately, there's no way for doctors to be 100% sure that the cancer won't return in the future. Thank you so much for watching. Please like and subscribe.